Stealing from Ebola to fight Zika. Nobody should be surprised when the present House of Representatives, dominated by penurious reactionaries, produces a stingy response to a danger that calls for compassionate largesse. But for sheer fecklessness it's hard to top the House's response this week to the Zika virus. The salient feature is that in providing money to fight one health menace, it steals from other funds meant to fight an even more dangerous threat, the Ebola virus. In February, President Obama asked Congress for $1.9 billion to help fight Zika, a virus that can cause severe birth defects and has been linked to neurological disorders in adults. Transmittable by mosquitoes and through sex, Zika broke out last year in Brazil and has since spread to the United States and other countries. Experts fear there could eventually be hundreds of thousands of infections in Puerto Rico, where nearly half the population lives below the poverty line, with possibly hundreds of babies affected. States in the American South with large mosquito populations are also at particular risk. On Thursday, the Senate voted for $1.1 billion in emergency funds for research, vaccine development, mosquito control efforts and other programs. The bill does not provide as much money as public health agencies like the Centers for Disease Control and Prevention say they need, but it is a decent start. The House bill approved Wednesday would provide just over half that $622 million. Further, the House insisted that even that sum be offset by cuts to other programs, including those aimed at Ebola. That makes no sense. It would shortchange critical efforts to strengthen public health systems in Africa in order to prevent a resurgence of Ebola, which killed more than 11,000 people, and other diseases. The money in the House bill would be available only until the end of September, when the fiscal year ends. That cutoff seems to assume that Zika will no longer be a problem by then, an absurdly risky line of reasoning that most health experts do not accept. Cutting off funds that early would also severely hamper the effort to create a Zika vaccine, which is expected to take more than a year to develop and test.